Of course, in physiotherapy, we should apply, say, a common principle of medicine, principle of individuality. So we should ask, before prescription of any procedures, we should ask our patient about his or her tolerance to any physical factors and about his previous or her previous experience of physiotherapeutical methods application before. Very important principle of continuity when we should continue in small doses or different procedures, or when we can apply, when we can change different procedures for prolongation of therapeutical effects. Principles of integrated approach. It's also a principle of medical practice which helps to estimate possible contraindications from other systems except damage system. It helps to avoid harmful effect and can help to, or and allow to maintain the satisfaction of patients by our treatment. And also one principle, as you can see, principle of course treatment. This principle means that we can apply, or we will prescribe in practice therapeutical technologies during defined time, defined time before, for example, usual duration of any procedures. Course is 10 times, 10 or 12 times. Of course, it depends on individual sensitivity of patient. It depends on effectiveness. It depends on presence or absence of possible negative reactions on this factor. On this slide, you can see the simple scheme of physiotherapeutic procedures appointment, which can explain for you simple algorithm of actions before a correct choice of a good choice and application physiotherapeutical method. First step which we should make, it is estimation of the general contraindication to physiotherapy, to physiotherapeutical methods. Some later today, I will present for your attention the list of general contraindications for any physiotherapeutical procedures. If patient has not any contraindications, we should assess his or her leading clinical syndrome of existing disease. For example, syndrome of arterial hypertension, syndrome of bronchial obstruction, pain syndrome. And according to this syndrome, we can suggest, we can choose the most appropriate method of physiotherapy. And of course, after that, after completing the course of application, we can estimate the effectiveness of this method or combination of different methods. As I promised, now you can see the list of general contraindications for physiotherapy. In first place, you can see the most important, most dangerous pathology, which unfortunately we can stimulate a progression. We can activate progression of oncological disease or or even suspicion on oncological disease. Don't allow for us to apply, to prescribe physiotherapy. Oncological disease, absolutely any location. Why this disease prohibited for application of physical factors? Because even not so aggressive, indifferent action can stimulate any tumor growth, especially malignant tumors, by stimulation of metabolism, by stimulation of by vasodilation, by stimulation of circulation and trophic processes. Next point, next position, take active infectious diseases and separately active tuberculosis, especially if this disease accompanies with fever. So fever, it's also maybe even separate fever. We can estimate it as contraindication. Disease of internal organs in stage of decompensation. What does it mean? It means the expressed forms of chronic heart failure with dyspnea at rest, with severe edema, chronic respiratory failure, also edema at rest, chronic renal failure, of course. Disease of internal organs are the diseases maybe COPD, and other. General blood diseases, blood system diseases such as leukosis, thrombophilia, thrombocytopenia, hemorrhagic vasculitis, and other. And of course, oncological blood disease. As you can see on the last point, intolerance to physical factor action. Other disease which we can apply for continue this list: epilepsy, serious forms of hyperfunction of endocrine glands, such as pheochromocytoma, it's concussion syndrome and disease, and others. Hemorrhagic conditions, which you can see here, it is patients with hematoma. Thrombosis. Thrombosis, for example, is complication of COVID-19 infection. And cachexia. Cachexia as outcome of oncological disease progression. Now the time to estimate, to explain, describe and explain classification of main methods of physiotherapeutical practice. Let's discuss first part of methods, concrete methods. We'll continue our discussion today with explanation of mechanisms, indications, contraindications of 4 methods of electrotreatment. All methods of electrotreatment we can divide on direct current methods of low voltage and small power, just 2 technology, methodics based on this application of low voltage current, which is galvanization and medicinal electrophoresis. Second group of electrotreatment is impulse direct current. This group includes electrobeam therapy. I'll explain some later. Electroanalgesia, transcutaneous electroneurostimulation, and dynamotherapy. And also one third subgroup of methods of electrotreatment is alternating current, or methods of alternating current. This group includes amplipulse therapy, interferential therapy, fluctuarization, decimalization, and ultratone therapy. The next group of separate independent electromagnetic physical factors which we can apply in practice is electromagnetic fields. And divide all fields on ultra high frequency therapy, UHF, super high frequency. And methods magnetic fields, which we can divide on low intensity and high intensity magnetic therapy. On this slide, you can see main methods of light, radiation, or phototherapy. As I said, next lecture, next Monday, we'll devote to the description and explanation of phototherapy, methods of phototherapy. And this group includes infrared therapy, invisible light, chromotherapy, or visible radiation, different colors. Ultraviolet therapy, which includes 3 parts: long wave, middle wave, and short wave UV rays. And a separate and even artificial light therapeutical light radiation technology, monochromatic coherent laser radiation, or laser therapy. And also one group of physical factor, which you can see here. It is methods of mechanical, which based on mechanical oscillation. First is ultrasonic therapy, using of ultrasonic waves for achievement of different therapeutical purposes. And second is massage, mechanical hand massage, or maybe massage by electrical device, but it's also mechanical oscillation method. Also, next groups which we will study and with practical classes. It's method of water therapy application or hydrotherapy methods, including mineral water, or balneotherapy. Warm therapy methods, which you can see on the low picture. This is application of medicinal mud, so-called pelloid therapy, and pseudo-pelloid therapy, or application of paraffin and ozoceride. And relatively low famous methods of air ionotherapy, aerosol therapy, especially for patients with respiratory disorders and after COVID infection, barotherapy or oxygen therapy under pressure, high pressure, and climate therapy. This therapy combines different physical factors. Of course, you have to understand that application of different physical factors on human organism may be dangerous. So accept safety precautions before procedure. We should inform the patient about possible rules of safety and possible side effects or unpleasant feelings during physiotherapy procedure. And during each procedure, physiotherapist should control his patient's stage and short action and stop action, in case of negative results of procedure. For example, burning effect of electric current or very high hyperemia, very severe hyperemia under ultraviolet or infrared action. Which pathological reactions on physiotherapy patients should explain, and you can detect any also problems. As there are general deterioration of state or general weakness, headache, cardialgia, so chest pain, problems with dream, sleeplessness, depression of appetite, adenomia or absence of any forces, muscle weakness, and fast fatigability after physiotherapy procedure. It's not so good. There are pathological reactions which we have to try to avoid in our practice. And this is conclusion of first part of this today's lecture, that physiotherapeutic methods we can apply, we can may to include in program of different disease recovery or rehabilitation treatment. Of course, in case of contraindications absence. If you have any questions, you can ask me, or you can write your question to our lecture chat. And before break, 6 or 7 minutes, we'll start second part of our lecture, or electrotreatment in practice.